As I said at the beginning, I'm the executive director of the HIV Legal Network, and I'm delighted that you're all joining us today for our 9th symposium on HIV law and human rights. So my task today is to set the scene for our discussions. So I'm going to start by setting our discussions today first in a global context and then bring things down to the domestic level. Some of you will be aware that just last week, the international community adopted a new global AIDS strategy that sets new, ambitious, and important targets for addressing HIV by 2025 on the road to ending HIV as a public health threat by 2030, one of the Sustainable Development Goals. Obviously, a lot needs to happen and a lot needs to change for that to become a reality. And today, at today's symposium, we're focusing on what needs to be done to address HIV and related harms among people who use drugs, the members of our community who are too often marginalized and stigmatized and criminalized. And our task is to change that. We know that this harmful environment causes poor health outcomes. Globally, the risk of HIV is 29 times higher among people who inject drugs. And as the new global AIDS strategy, with its focus on ending inequalities in order to end AIDS, points out, one of the central reasons that disparities in the HIV response remain so stark is that we have not addressed in many places and in many cases the societal and structural factors that increase people's vulnerability to HIV and impede their ability to access the care and services that they need. The global strategy is quite clear that the evidence consistently shows us that criminalizing key populations, including people who use drugs, is one of the structural barriers that we must address, and says quite directly that unless we address the stigma, the discrimination, the criminalization of key populations, and other human rights violations, we will not achieve the Sustainable Development Goals, specifically the goal of ending AIDS. It is impossible to overcome this public health challenge that has been going on for now 40 plus years without attending to those structural factors, without protecting and respecting and realizing people's human rights. And certainly there's a lot of work to do. Among the countries that reported data to UNAIDS in 2019, and not every country does or does consistently, 111 of them criminalize the use or possession of drugs for personal use. The strategy also notes that the health and well-being of people living in prison or other closed settings, which we know includes a very substantial number of people who use drugs, given the criminalization of drug use and possession, their health and well-being is put at risk by punitive laws and policies, not only the ones that put people in prison and in conflict with law in the first place, but then further punish people and deny them equal access to services, including harm reduction services. The new global AIDS strategy sets out a number of ambitious targets, as I've mentioned. Some of them are familiar from the previous global AIDS strategy, but with some updated figures. And those are the new targets of achieving 95s across a number of indicators. So I've highlighted here the ones that are perhaps most directly relevant. So 95% of people at risk of HIV use combination prevention. That obviously includes access to prevention services for people who use drugs. And at the bottom on the right-hand side, 90% of people who are living with HIV and people at risk are linked to the health services that they need. But on the left-hand side, and this is the important new addition to the global AIDS strategy and hopefully the global response, is attention to the things that produce those barriers to prevention services and produce those barriers to access to healthcare. And that is why, in order to achieve those health outcomes, we also need to end some of the inequalities that are driving them, including ensuring that less than 10% of people who are living with HIV or who belong to key populations, including people who use drugs, are experiencing stigma and discrimination, and that less than 10% of countries have punitive laws and policies, which is, of course, the focus of today's symposium. There are a number of result areas in the global strategy that are all of relevance to responding to HIV among people who use drugs, but I want to highlight just two. The first is the result area that deals specifically with HIV prevention, and the second is the result area dealing specifically with human rights and stigma and discrimination. I think it's also important to note that not only is human rights an area in which specific results are to be achieved if we are successfully implementing the strategy, but it is also recognized quite properly that human rights, including gender equality, is a cross-cutting issue that must be taken account of in every area of the strategy, or else we will leave people behind and we will fail to achieve the targets that have been adopted now by the international community. So in order to implement this strategy, it is explicitly recognized now that governments must invest in creating an enabling environment, specifically attending to a number of what are referred to as societal enablers. And this includes investing in efforts to change legal environments so that they in fact enable an effective response by ensuring that people can have access to the prevention tools that they need and access to the healthcare that they need. So in the HIV prevention area, states have now agreed and committed to intensifying their efforts to scale up comprehensive harm reduction for people who inject drugs in all settings. And in particular, there is explicit reference as well to ensuring that people who are in prison or other closed settings also benefit from the goal of universal access to these services. And in the human rights result area, the obligation is to create an enabling legal environment by removing punitive and discriminatory laws and policies on a number of fronts, including laws that criminalize drug use or possession for personal use. But it's not just about getting rid of bad and harmful laws, which is an important part of our project here, but it's also about proactively taking measures and adopting legislation and policy that actually will protect and promote people's health. It means funding the services that are needed to prevent infection in the first place and ensure that people living with HIV are ensured access to the care that they need. So this brings us then to what will we do in Canada? And that is the focus of our discussion today. Data from police forces across the country reported to the federal government establishes that between 2014 and 2018, more than 70% of drug arrests in Canada were for personal possession of drugs. So that is possession of drugs for personal use. So we have a serious challenge here to address the legal environment in which we are attempting to respond to HIV and to other harms, such as overdose, among people who use drugs. And the first part of today's discussion will be a focus on how we get to decriminalization and what's been happening lately. In fact, there is, quite importantly, growing support for decriminalization, not just, of course, from people who use drugs and those of us who care about people who use drugs, but in fact, from governments at different levels, from all UN agencies who have now adopted a common position of the UN system, calling on states to decriminalize simple possession. And importantly, if we're being honest and realistic, there is growing support from law enforcement for decriminalization. And we'll talk more later today about what that might mean and what the contours of decriminalization should look like, because there are some different views about that. The point is that there is now more support than there has ever been, and from a broader cross-section of Canadian society and different quarters than there has ever been. There is an opportunity, a moment, an obligation here now to make change, to achieve a more enabling legal environment. And there is support in public opinion growing for making such changes. So how do we get there? That's important. There are two ways, basically. One can be done sooner, faster, more easily. The other will take a bit more work. Both are needed. And there is advocacy happening on both fronts, as we'll talk about in a moment. The first is to use the existing flexibility in Canada's federal drug laws that criminalize simple possession and other activities, and issue exemptions that will exempt people from prosecution in a number of circumstances and under certain parameters. The second, of course, the longer term fix that is required is to change the law and to get rid of the underlying criminal prohibition in the first place. And we'll talk about those and proposals to do that. It is important to remember, and as recent experience that we'll hear about shortly has illustrated, that the way in which this is done, including defining quantities of substances that people may be allowed to possess without risking criminal prosecution, is important. And decriminalization needs to be done correctly if it is to be meaningful and effective. So we'll start today's discussion with an examination of the issue of decriminalization and efforts that are underway to change the underlying legal environment. We'll move from that to the specifics of some proactive measures that need to be taken to ensure access to some of the health services that are needed to protect people's health, including reducing barriers to supervised consumption services and expanding modes of delivery for safe supply. So let me turn to the first panel today, which is to look at decriminalization. We'll start with a brief address from the Honorable Patty Hajdu, the Minister of Health, and then I'll introduce the members of the first segment of our discussion on decriminalization.